Hello, my name is Dr. Angelica, and I'm an epidemiologist. An epidemiologist is someone who specializes in disease and the prevention and control. So, due to that fact, I also must apologize to the manner of which the gentleman who brought you here, because I do understand that the way they did it was quite forceful and violent, but you must understand that the disease you have is quite a rare and unique one, and we were going to be needing you to come into our laboratory as soon as possible as a matter of state and possible international concern, considering how if what you have is contagious, you will end up affecting the world in a way that it has not known. However, right now, I am going to be conducting my exam because, frankly, the known, as you very well know, side effects of your disease is that you're losing your senses. And so, right now I know you can't smell anything, you can't feel anything, and your hearing is also fading. But let me simply test that theory, okay? So, keep still. I'm gonna be simply plucking your face. You tell me if you can feel it. If you can't feel it, I'll just go a little harder and a little harder. I might even press my nail into your skin just to see if that'll get a reaction, obviously. And if that doesn't work, then I'll get some tools to use that'll be a little harder. I'm not gonna leave a bruise or scar or anything like that, but I am going to be seeing if you truly can't feel anything or if it's just mild numbness and whatnot. But I do believe that it's, the former rather than the latter. So I'm just going to be tapping your face. Just tell me if you feel anything. Still nothing? Okay. Okay, just going to dig my nail into you now. Can you feel it? Thought not. Okay. This pen doesn't really have any ink in it, so don't worry about me marking up your face. It's dead completely. We just use it because of the finite point, obviously. So I'm just gonna be doing exactly the same thing that I was doing, but with a pen instead of a finger. So give me one moment. Once more, tell me if you feel anything. Still nothing? Okay. Okay. Understandable. Completely understandable. Well, if you can't feel anything, then obviously you've lost the sense. I'm not quite sure. Our radiologist is going to be reporting back to us with the scans that we've conducted on your brain to see if it might be a neurological disorder, but for right now, I don't know exactly how we're going to be able to help you regain that sense. Right now we just want to find out the root cause of it in order to cure it the best we can. But for right now, I want to conduct a smelling test to test your sense of smell. If you can't smell it, then simply tell me you can't smell it. I'm going to be showing you going to give you different vials of scents, some of them very potent and, awful smelling, some of them sweet and mild, and it's just going to start off with the sweet and mild scents, and then we're going to work our way up to the very potent, rotten ones. And if you can't smell the potent, rotten ones, then that's both a tragedy and a miracle, I guess. The smelling samples are going to be 2 sprays and 2 substances found within vials, or containers rather. So I think the first one we're going to start off with is going to be the spray. So I'm going to spray this. You tell me if you want a second to try. I'll spray it again. We're only going to do it twice simply because by the second time you should be able to smell it. If you can't, just tell me that you can't. If you can, then awesome, tell me that you can, and if you can identify the scent, then obviously tell me what it is. Let's start. Okay. Can you guess it? Can't even smell it. Okay. That was vanilla. So obviously it's one of the softer, nicer smelling ones. Now I'm going to be starting off with the substances. So can you smell what that is? Take your time. Okay. No, it's okay. This one was caramel. Once more with the spray. Ready? Okay. Once more. Okay. Can you smell it? Right, so 3 for 3. Okay, so the final one should be is the most potent one. So just brace yourself, because if you can smell it, you're gonna wish you didn't smell it. So here you go. Just stick your nose in there and give it a good whiff. Can you smell it? I thought not. If you could smell it, you would have recoiled your neck right back to where it was, because this was 3 months worth of rotten eggs. So a nice paste for when you want to prank someone. So clearly your sense of smell is, gone, obviously. So that just leaves a bit of your sense of hearing, your sense of sight, and your oh, you lost your sense of taste too? When did this happen? It was the first one to go? Ooh. Okay. Let me see if I can get a vanilla extract, because I know I have some lying around, and simply I'm gonna grab a sample of vanilla extract. I want you to stick your tongue out, and I'll dip the substance onto your tongue, and then you tell me if you can taste it. If not, I'm sorry, but we're gonna use the rotten eggs, and I'm just gonna dip a little bit of the rotten eggs onto your tongue, and if you still can't taste that, then you don't have to swallow it. If you swallow it, obviously it's gonna make you sick, but if you can't taste it, then yeah, that sense is gone. But I simply want to test it simply for our records, obviously. So stick your tongue out like you don't have to stick it all the way out, just enough for me to actually dip the substance onto it. And there we go. Can you taste it? Okay, understandable. If you couldn't smell the vanilla extract, I couldn't really expect you to taste the vanilla extract. Now let me just dip. This is gonna be gross, but bear with me. This is all in the name of science. I'm gonna be dipping a bit of this rotten egg extract onto your tongue. Do not swallow it. If you swallow it, you are going to implode. Do not swallow it. Tell me if you taste it. That's the most important part. If you can taste the fumes of this, then that is excellent. Then that means you regained a sense that you lost, and that helps us to go in the right direction as to how to solve the other two senses lost. But if not, then it's understandable, and it's obviously a very good thing for you temporarily. So stick your tongue out again, and I'm gonna put it on. tell me if you taste it. Still nothing? I think this time that one was for the best, but if you didn't taste either, then yes, your sense of taste is also gone, which means all you have left is your sense of hearing and your sense of sight. So when your sense of sight ends up going, or your sense of hearing, considering how that's the first one that's leaving, indicate to the fact so that way we can be aware of your progression of the disease, okay? But for right now, I'm going to be testing your hearing senses just to see how well they're keeping up. Okay, so I'm just going to be making some sounds around you. And tell me if you can hear it. You can hear it? Okay, how about this side? Can you hear it? Excellent. Again? Okay. 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 So your hearing is still working. It might be fading a little bit, but it's still going well, so that's excellent to hear. Now I'm going to be checking your visual motor skills. So if you will, I'm going to be moving my fingers around. Keep your neck still, keep your head still, just follow my fingers around. When they end up leaving your peripheral vision, tell me, and then I will simply test your vision that way. So I'll be testing your peripheral vision, okay? Okay, so look at my nose and tell me when my fingers leave your field of vision, okay? Okay. 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 Good. 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 And good. Your vision's fading out? Your hearing's fading out. Tell me what's going on. Tell me it in detail. Is your vision blurring out? Is it blacking out? Is your hearing just becoming more of a ringing sound? What's going on? Can you see me? Can you hear me?